Welcome back to Out of Network. I'm Dr. Ryon Parker here with Dr. Rishi Seth. Today we're talking about a topic that's moving fast in every part of life, and certainly definitely in medicine, and that's AI. We're seeing it in charting, in diagnostics, in patient communication, in hospital systems, and whether you love it or hate it, it's here. And a lot of physicians, including us, are trying to really figure out how to use it without losing the skills that make us good physicians in the first place.
I'll be the first one to admit it. AI has made me a better doctor and a lazier one. It's helped me document faster, stay organized, and focus more on my patients. But there's also a real downside. When you start relying on it too much, you forget things you used to remember automatically. You trust it when you shouldn't. And sometimes, like we'll talk about, it gives you answers that are flat out wrong.
So today, we're breaking down where AI actually helps, where it hurts, and how it changes the doctor-patient relationships, and what the future might look like if we're not careful.
All right, and today we're going to start off with talking about AI and in healthcare and what we're seeing today and hopefully in the future. Dr. Parker.
Yes. I think one of our episodes we had talked about one of the biggest advances in healthcare, and I think it is the use of AI technology. So, I make it very well known that I use AI. I think AI has definitely made me a better physician, but I also think AI has made me a lazier physician. So I can get into that. But I think AI is here. I think it's time that we embrace it, but I also think we respect it very much. So, I want to be very clear. I use AI mostly for charting and documentation purposes. I make every patient sign a disclosure that they are going to be recorded. Primarily, it's a HIPAA platform, so their information is very much held private. But it's using information that we talk about in a clinical setting to condense it into a physician note that is better and more succinct, provides evidence-based citations as a quick reference. Is it perfect? No, but it has definitely helped me spend more of the time that I want to with patients, or I'm not worried about all the specific details and honestly, documentation takes a lot of work. It takes time away from family, and where I can spend maybe more time with the patient and 3 minutes dictating, documenting, it's certainly better. So what are your thoughts? How would you think that patients would think about you if you used AI?
So I do use it. My patients have no problem with it.
Yeah.
I'm not gonna lie, I'm gonna stop using it, and at least in the scribe form.
Okay.
So 2 years ago, when kind of the AI scribe was started, it was like, oh, it's gonna be like the greatest thing. Physicians started to love it. What the scribe is that it basically records everything that's going on, and it presents it back into the note, and it does it supposedly by advertisement, very well succinct information. That's what it's advertised as. Reality is that I haven't seen it be that perfect yet.
And I think it depends on the software that you're using as well.
Yeah, like the one I use for my EMR is terrible. We're not going to tell you which EMR, but I want my money back.
Will you tell the story, please? I'm Brad Pitt.
Yeah, so I was with a patient. We were just talking about the movies, and I was like, oh, we went and saw this great movie with my kids, and it was F1, and it was Brad Pitt. It was fantastic. And then, afterwards, I'm going to the room. I look at my note, and at the bottom in the assessment is, go see movies, go see Brad Pitt movies. Like, that's my diagnosis and my recommendation.
To cure their blood pressure.
Yeah, exactly. So,
Thankfully, you proofread that note, right?
It's the one time, right?
I know if I was reading your note, I would raise an eyebrow at that.
Like, look at this. Yeah, doc, he's thinking outside the box.
Yeah, perfect.
Yeah. So I think the AI scribe has a long ways to go. I actually think that it hinders my treatment in that, one of the things that we have been taught in medical school and residency is how to present a patient. And part of the reason why presenting a patient is important is to create succinct information, to the doctor.
Right.
But reality is the most important part of that is for memory. So when I talk about my patients, I've seen tens of thousands of patients in my life, yet I can still remember them because I would dictate it or I would go through the chart. And when you're dictating it, you're remembering it and regurgitating the information. It's
Well, there's
almost
an
like,
algorithm that we follow.
Right.
So it's very easy to retain information.
Exactly. So we retain decades worth of information. It's how we train.
Mm-hmm.
Well, I noticed that when I was with my patients and I was using the AI scribe, I didn't remember any of that information. Some of my patients would come to me and say, hey, well, I tried that medication that you told me to. I'm like, which one? And then I'd open up the chart and I was like, we talked about it, but I don't remember memorizing. So I think it's something that I have not trained with.
Yeah.
And so because I have not been trained with it, I don't know how to use it properly.
Yeah.
So I'm going to go back to the
Interesting.
the dictation.
I think there's pluses and minuses with it. You and I are very close and similar in age and training. And, I know I can tell a difference. Obviously, I've dictated in the past, seeing a lot of patients, and when you're in those moments, it forces you to remember vital information that's going to be put into a medical chart. And I can tell that when I happen to forget my recording device, my brain does shift, and I'm kind of forced to be very vigilant in remembering information, as opposed to if I have just a recording device in there. I don't want to say I'm cavalier, but I am definitely more focused on other things, and I just by a default assume that it's going to keep track of all that information. And I use a really good platform, and it's not 100% perfect, but for me, I am able to really record very detailed information that I probably, as I've gotten older, am not always good at remembering those details, where AI will do that. But again, to your point, it is not perfect. It is not perfect.
And now there's a discussion now in the public about potential de-skilling doctors. And I actually feel that this might happen if we depend too much on it, especially in the terms of diagnosis. So let's look at labs, for example. If we had a AI, like the ideal situation that's being sold to everybody is there's an AI, some sort of a AI entity that looks at labs and goes, ooh, that's the diagnosis, and then target and then treatment, right? That would be like the ideal thing that a CEO of a hospital would love. Right? The downside that I see of that would be I don't think people would look at the labs then.
Right.
Like, how many times have you looked at a CBC and a CMP and like in a second know what the problem is, right? It's because you've looked at it 30,000 times in your life.
Correct.
Right? And so we've looked at it, we've seen the patterns, we understand it. I had a patient yesterday who gave me his labs on a piece of paper, and I looked at it and I was like, okay. And then he goes, well, didn't you read it? And I go, yeah, I read every one. And then he quizzed me. He's like, what's my he said, what's my CO2? And I knew it was 23. And he goes, how did you remember? I'm like, because I know what normal looks like.
Yes.
Right?
Yeah.
And I've seen it 30, 40,000 times. Like, that's how it's going to work.
Yeah.
Now, if we do this with AI, maybe I don't see it 30,000 times. Maybe I only see it 100 times.
It's not creating that analytical thought process.
Right. And now that's super important. Like, I'll give you an example. When you diurese a patient with congestive heart failure, there's certain labs that will change. There's a thing called contraction alkalosis. You watch the CO2 level increase as you're diuresing them. These are nuances that a physician who's done it thousands of times understands it. And at what point do you change your diuretics or whatnot, right? I don't know if I have residents who would use AI algorithms. I don't know if they would catch that as early. Maybe they would after a long period of time. So, I worry that there's going to be a little bit of that.
Yeah. I can tell and I'm not saying that the newer generation of residents and physicians are not to the caliber as we are, or we have been trained, but I do somewhat have some fears with that. I teach at one of the programs, the family medicine programs, and they have been exposed from the beginning to AI. And that's all they use. And when I ask them to present in that SOAP format, they have difficulty, to your point. So are we training the next generation to be somewhat lazy?
I bet you if you look,
Or is it making, like I said earlier, I think it can make us lazy.
So I wonder if this time will tell on this, but I bet you they'll score well on those board exams, right? Because they're going to find those answers for those questions, and maybe AI is going to help them train to answer more questions. But will it come to reflect being good doctors?
And
I don't know about that.
And applicable, right? So I think it's definitely beneficial, but I think we need to respect it.
Yeah.
Right?
And I think that's where, like you said, adapting it. You have to adapt with the technology.
Yeah.
I don't want to be that guy who is like saying the wheel is the worst thing in the world, right? Like technology is going to be there. You have to evolve with it. And so, maybe the scribe is not the best thing in the world, at least for me. Maybe there's a version of the scribe that comes out that maybe that's something that works with me. And, I'm willing to evolve with it, but I'm not going to go and say it's the worst thing in the world.
So let me ask you, would you use AI to clarify a differential diagnosis? If you have a complicated patient, for example, are you still going to shy away from using AI to help with your medical decision making?
No, I use that all the time. I actually, there's open evidence. I mean, we already use forms of AI already, like everywhere, even up to
It's just another reference.
Yeah, like Up to Date, for example, that's a resource that physicians use because it's very, very in-depth. And, Up to Date has now AI algorithms in there too. So we're using it. It's helping search things. Open evidence is a great resource for physicians where you can type in what's going on and it'll give you differentials, and that's important. What I hope does not happen is that it only produces one solution, right? Because in medicine, we can't have one solution. We have to have multiple options.
Right. AI is not just in medical documentation, but we're also seeing it in even helping with staffing and kind of the everyday clinical needs. So, obviously when patients call our office, they actually get a real person. And I think in a small practice, patients are accustomed to that. And I know I would like that. But you're seeing a trend now where offices are incorporating these chatbots that actually sound like real humans and can provide real information. Is that something that you would consider using in your concierge office?
I think what we sell in our practice is a very small, very personal experience. So I don't think we would do that right now. It's possible that when we grow, if we need help, it's possible, but not for our current patients. Like maybe people who are looking for information about the practice, like, hey, I want to know what this is all about. And and these AI chatbots are pretty awesome. For reference, we were just playing with one. Her name was Emma, and she
sounded real.
Yeah. Now, I'll tell you, the thing that annoyed me was there was a 1 second pause. That 1 second pause, I know that sounds silly, but it's a computer.
It gave it away.
Yeah, it gave it away that it's an AI chatbot. And so, but when you called Emma answered the phone, says, "I'm Emma, and
how can I help you?
How can I help you? And by the way, I'm AI." And so, that was helpful to identify. If somebody didn't want to speak to an AI, they could, go in a different direction. Yeah. So that's good.
But she still did a good job of answering all your questions.
Yep. She answered all the questions, and I could feed it information about my practice, some of the services we provide.
Tell me about Seth Premier Medical.
Right.
Emma was able to do that.
Yeah, exactly. So that's an ideal situation for a sales perspective. But for patient care, I don't think that's something I would do, at least right now.
Yeah.
Maybe if I was in a large hospital center system where like patients are calling frequently and they need triage, like you had kind of suggested,
Yeah.
then that might be something that might be a good idea.
Yeah. I also see it being very scary. So imagine a patient who's having chest pain and they call the office and they get Emma, our AI, and the gentleman on the phone is saying, I am having crushing chest pain. And Emma, who is not a human, and I know what my nurse in my office would be asking and saying and doing within a millisecond, you can only imagine Emma saying, well, can you classify this between 1 and, is it as low as 1 or as high as a 10? And by the time they finally get to that human, did the patient already have the heart attack?
And how many times did they say, great question. That's a fabulous question. Wonderful thought. Like, I wish they would stop that.
Yeah.
It's so annoying.
So it's a liability issue as well. So do you see, I guess for those physicians that are using it, even me dictating, does that increase our liability in any way?
Yeah, I mean, it's that I worry that it's like going to be the AI, like the image of the future, the over testing. Now I'm going to over AI everything because I'm trying to reduce my liability. Now I'm going through so much AI, but I don't know. We'll see about that. What I do think, and I'm going to tell you a true story. Okay, you're going to laugh.
I'm ready
about this. I had a mole that I was like worried about, so I used an AI skin program, and it told me that this thing was potentially precancerous. So I went and got.
And for those that can't see, Dr. Seth has this large red lesion
right
on
here,
his
right
cheek.
here. Not so much here, but right here. That's a Tommy Boy reference, but so I went and saw my dermatologist and he took it out. Pathology came back, ingrown hair. I can tell you that my wife was like, "You are an idiot,"
Yeah.
but that was the AI.
Sure.
The AI is a test that I took. I took a picture. It screened it. It said, "Has it growing in a certain amount of time?" And it was.
Imagine if you weren't a physician and you were you are using AI for your own as a doctor.
Yeah.
Do you think this is going to lead to many people who are going to suffer consequences?
100%. Think about this.
Yeah.
Let's say we do not use clinical acumen in this. And for relative context, what that means is the doctor talking to the patient, understanding their symptoms, their vital signs, their physical exam. Let's just say you did radiology exams, right? Chest x-rays there's a lot of inaccuracy testing, false positives associated with chest x-rays.
Right.
Imagine like we just relied on AI to do radiology reports, right? And particularly chest x-rays. Everybody would be diagnosed with pneumonia.
Right.
There'd be 80,000 nodules found.
Everybody's been getting biopsies.
They'd be getting antibiotics and biopsies. And so that is over testing. And always remember, there's death associated with over biopsying. You do a lung nodule biopsy.
Sure.
Yeah. So you have to take things into context in these situations. So there has to be some oversight in there.
Yeah. And who would be responsible? I mean, I can only imagine those patients who truly are believing this and they're having the chest pain and they say, oh, it could just be heartburn when actually they're having a heart attack and they're not going to the hospital.
Right.
So is that ChatGPT, for example, held accountable?
Yeah.
And how can they?
Yeah. That's a really great point.
You know what I mean?
No one's going after Sam Altman.
Right.
But there's a lot of in-depth conversations being held with ChatGPT.
Right.
But nothing about their health.
Right. Right.
So what's really interesting, and have you used a lot of ChatGPT?
Not really. I mean, I think I like it if I want to write a really good professional letter. Okay. Specifically to an insurance company. Yeah. If I want to drive a point home and I want my patient's sleep study to be approved, I'm going to use ChatGPT and it will write a Shakespearean letter.
So I use ChatGPT a lot for business stuff, right?
Mhm.
So like asking it questions about like, marketing and stuff like that. So so it's understood me as a business person. It also understands my clinic because I talk about my clinic a lot to ChatGPT. And then, random things like I'll ask questions about sometimes medical things like what about differentials? And I just want to see what they're thinking.
Mhm.
Not what it's thinking. Um but what I found is the answers are very curated to me and including my mistakes, right?
Interesting.
And so like there was this one time I had a patient that I was working with, and the diagnosis of like their blood disorder was in the differential, and I just kind of wanted to know some questions about it. And so I brought up the like some of the differentials of it, and it turned out to be like a low level leukemia. Okay. All right. Well, that incidence of low level leukemia is like 0.01% of the general population. Well, guess what? It often recommends me to keep reading up. And like in the differential of like random elevated hematocrits in a patient, which can be, you know, lab test
Sure.
errors. Did you think about leukemia? And you're like,
Yeah.
okay, like
Yeah.
you're bias. It's almost becoming biased towards what things
Right.
I'm seeing,
Right.
which then that makes me concerned because I know my bias. But if you're confirming my bias,
Mhm.
then that makes me doubly think that I'm right, and that's dangerous,
Right.
right?
Extremely.
Then
Extremely.
my thought process is fit into a box, and that those are some of the things that I'm like, how do I get away from this?
There's something to being said about that human element that cannot be disregarded, right?
Right.
So,
And one of the things, a great thing about being a physician, is you're not infallible.
right.
Like, and that's actually like when you become a like an older doctor, you start to learn how fallible you are, like how
Correct.
error prone any human being is,
Yeah.
and so you really respect that. You really
Absolutely.
understand that,
Know when it's time to hang up that stethoscope,
right?
right?
And like, I would not want someone to like encourage me to make mistakes, almost. So
Right. Right. It is interesting though when you put in who is the best concierge doctor in Tampa, Florida. I'm so happy to see that you come up. So maybe it's working towards my bias as well.
I think you did.
Can-
Did you check
can-
it in our
can-
neighborhood? Is that what it was?
Can anyone do that in Las Vegas, please?
I can almost surely tell you that.
I know my name's going to be at the top of the
That's
list.
right. That's right. Let's drive that.
Who did we pay, right? One thing that we get this all the time, even before AI, is patients that use the internet and the medical consulting on the websites. They're always challenging us, right? So, well, you may think this, Dr. Parker, but MD.com basically is saying this, and almost having to always be a little defensive in a way, right? And I jokingly say, don't confuse my degree for Google, right?
Yeah.
So, do you ever struggle with that, or patients are always questioning your diagnoses or your decision making and your plans?
I learned very early in as an attending to welcome that.
Yeah.
Because two reasons why. It kind of it breaks the guard of the patient.
Mm-hmm.
That patient is coming filled. Like, I love the ones who like print out information, like there's highlighters on there,
Yeah.
and you're like, okay, like this patient has read,
Yeah.
and so they're ready, and that's okay. And so then I gotta see if they're right or wrong, and if they're right, I gotta work with them.
Yeah.
If they're wrong, it's my goal, it's my job to educate them.
Right.
So the web and again, this is the downside with the AI chatbots, is that it will agree a lot with that patient and then reinforce some of their mistakes, and then potentially that will make the bridge between us harder to gap. So,
And I think in smaller offices such as ours, people are paying for that experience. They are paying for that small town feel. They're paying for a human. And I think using AI in that capacity, I think would be very harmful for our businesses. I think harmful for a lot of concierge offices who claim to want to provide that personal touch, right?
Yeah. I agree. Like if all our patients, they have a cell phone number that they reach out to us. They text us all the time.
Yeah.
And, we answer it
There's
within a
something
week.
being said about that.
Yeah. And so can you imagine if there was like an automated response? I hate automated responses in general.
Personally, right?
And like, can you imagine your concierge doctor giving an automated response? Like, no.
No, that's when it's time to hang up the stethoscope if
Yeah.
you're doing that, in my opinion. So.
Yeah. Or just sell to private equity.
Right. That's what patients are paying for. They're paying for that small town feel. They're paying. I mean, how many times does a patient really get the opportunity to call a number and immediately have a doctor on that other end, right?
Yeah.
So
It's that takes a huge amount of sacrifice.
right.
Like, you know this. I mean, you've done it for so many years, but like from my perspective, I mean, it's a very, very large task to do.
Yeah.
But there's a goal at the end, delivering a great product and hoping that you're really changing people's lives.
Yeah. I think in summary, I think always being transparent with your patients is important. And yes, if they don't know now, if they didn't know then, they know now that I use AI and it's mostly for documentation. I think it's great. It does have its limitations, but I hope it gets better.
And I think for me, I am willing to evolve with AI and scribe and documentation. I think for me, it's not there yet. However, I think with diagnosis, it's helpful.
Sure.
Great apps like Open Evidence, and as long as they start to continue to evolve in quality, I'm really excited about the future. And I also think that there needs AI oversight. Each individual physician needs to oversight. You need, if anything, it means that physicians need to up their game, because you need to make sure that you're saving the patient from, AI, what do they call it, hallucinations or something?
Sure.
Like there's going to be something. So you have to be on the ball.
Yeah. Very good. Any other final thoughts?
I think we have a part 2 of this.
Okay.
Stay tuned for part 2.
Thanks for watching. AI is changing medicine faster than most people realize, and it can absolutely make us better, more efficient doctors. But only if we stay grounded in clinical judgment, real-world experience, and the human side of care.
Exactly. The risk isn't AI replacing doctors. It's doctors forgetting how to think, forgetting how to analyze labs, present patients, or trust their instincts. AI should support medicine, not practice it for us. If this conversation gave you something to think about, hit subscribe. Leave us a review, share it with someone who loves this topic, and as always, shout it from the rooftops. And if you're in Tampa or Las Vegas and want a physician who actually knows you, not a chatbot, we'd love to take care of you. In Tampa, visit us at Seth Premier Medical. And in Las Vegas, visit Dr. Parker and his team at Parker Medical. All the links are in the show notes below.
Thanks for listening. We'll see you on the next episode of Out of Network.